Now, you ready for speaker number 2? Yes? Right, we've got 7 people now that are ready. Happy days, right? So, I suppose as a society, then, if we're to truly address the impact of the harms that are caused by substance use and addiction, then we really do need passionate organisations with strong leadership from the grassroots level right up top to policymakers. And there is no one positioned better than that to demonstrate that passion than our next speaker. I had the pleasure with connecting with Paula Leonard, CEO of the Alcohol Forum Ireland, I suppose over the last 12 months. And we continue to forge a really strong relationship and cross-border links aimed at supporting the recovery community in the northwest of Ireland. And we're doing that in partnership with the World Health Organization, Developing Healthy Cities, based here in Derry, and the Alcohol Forum Ireland. So, it gives me great pleasure to welcome Paula Leonard, CEO of Alcohol Forum Ireland, to the stage. Round of applause, thank you. Welcome, Paula.
Thank you. How you doing? I was just checking my mic is on. Yes, I've changed my hair since this photo. We should have updated that. Look, I was very moved actually by Owen's presentation this morning. When I was leaving my house this morning, which is only 5 miles down the road, my daughter said to me, "So why are you in such a hurry?" And I said, she also said, "Why are you wearing a suit?" But she said, "Where are you going today?" And I said, "I'm going into the Millennium Forum." "What are you going to see?" And I said, "No, I'm not going to see anything. I'm going to be speaking." "In the Millennium Forum? On a stage where we saw Swan Lake?" And I said, "Yes." And she said, "What are you going to talk about?" And I thought, oh God, am I going to tell her I'm going to talk about the levels of alcohol harm and the number of people we lose in our lives as a result of alcohol and other drugs, and the people who don't make that recovery journey, unfortunately. And I just looked at her and I thought, you know, I'm going to talk about love. And she goes, "Oh, that's nice." And listening to Owen and, you know, listening to the people who have spoke this morning, really, I suppose, the biggest power that the recovery community have is love and those stories and that narrative. And when, I suppose, Gary spoke this morning, he talked about changing the narrative. And really, that's just a fancy way of saying changing the story. And we change the story by telling our stories and by connecting with that. And I suppose when I came to this work from sort of a health inequalities background a number of years ago, I felt a little bit out of kilter, you know, at a European level and at an Irish level, that I wasn't coming from a research or a public health background. And I was a dyed-in-the-wool community worker from the top of my head to my tippy toes, and that I believed the power of communities and of people to change their own stories. And what I've discovered, I suppose, on that journey is that public health and research are absolutely needed, and we need them on the journey. But they need to hold hands with the people who have lived experience, because only by doing that can we really truly connect with what needs to happen and what needs to change in our society. So I suppose when I was looking at the theme, I thought more than, you know, it's got to be more than public health. It's got to be more than research on its own. It's got to be more than community workers. It's got to be more than people in recovery. It's got to be all of us, because to change the story, we are going to need to climb a mountain and change the world. The power of these ARC recovery conferences is giving us a shared language. And that shared language doesn't mean that the story is the same for everyone. It actually means that it's different. But Alcohol Forum Ireland, I suppose, was formed about 15, 16 years ago now, in direct response to the number of children in Donegal who were going into the care of the state, alternative care or family care, as a direct result of parental alcohol and other drug use. And the people who were involved at the time in the care end of it were saying, we need to think about this. We don't need to take children out of their homes if we could intervene earlier, and if we could do something about this, and if we could change the story for those children and for the generations that come after. And that's where we came from. And today, we are exactly the same as ARC Recovery. We have a team of 14, a fabulous team of 14. Some of them are here today. I can't see them with the lights, but, you know, hello, colleagues. And we have offices in Cavan. We have an office in Sligo that covers Sligo Leitrim and one in Donegal. We work at the family level. So we think that if a person is on that journey, you know, in treatment or in recovery, that it's not just them that needs to go on that journey, it's the entire family, and each family member has their own right to their own recovery journey. So we work at a national level, we support community action on alcohol at a national level, and more we're working at sort of a global level to sort of really challenge the people who have the power in relation to alcohol harm and what we do about it, and say, how are you going to really engage? How are you going to make those stories matter? So while I'm standing here today, for example, one of my colleagues is in Brussels talking about this, and one of our Community Action and Alcohol Network is at a World Health Organization conference in Barcelona, talking to similar themes, but in their own way. They did tell me which way to go. But just to sort of, what I wanted to do anyway was just to talk through something, and I'll keep an eye on my time. I've said I wouldn't go over it. Alcohol in Ireland, it's a huge cause for concern. It's a concern for all of us, and there's no community, no individual, no family who hasn't been impacted by alcohol harm. And unfortunately, by the time any of us get home and get into our beds tonight, after having whatever busy days we'll have after the conference, 4 more people will have lost their lives on this island as a direct result of alcohol. To me, that's a statistic that we all need to be concerned about and think about and listen to. I'm not going to go through those, but particularly 1 in 4 deaths of young men between 15 and 39 is due to alcohol. And it's a factor in over 1/3 of all fatal road accidents. And unfortunately, this year we're seeing a significant increase in the number of people being killed on our roads. Among people who die by suicide in Ireland, the proportion of those who are dependent on alcohol is somewhere between 51% and 85%. Northern Ireland at a glance. Alcohol-related deaths in Northern Ireland are at a high. We had a decrease in 1 between 2021 and 2022. You've had 350 people lost their lives as a direct result of alcohol in 2021. That's 1 less than 2020, but it's 1/3 higher than it was a decade ago. Almost 2/3 of those deaths were male. Most deaths were among those who were 45 to 54 and 55 to 64. The Western Trust, so Gary talked a little bit about being in Derry and, you know, the pain and the loss that there is in this community. The Western Trust has the highest rate of alcohol-specific deaths, and as deprivation, so this is an equality issue as well, as deprivation increases, so do the rate of alcohol-specific deaths. So alcohol use here is a significant factor in respect to both self-harm and suicide. 70% of under 25s known to psychiatric services who later took their own lives had a drinking problem. So this cuts right across lots of other health issues, lots of other social issues, and lots of other conflict issues in our lives. But I suppose what we've seen, just these are the latest figures on 2022 from the Health Research Board, and what we've seen is a significant rise in the demand for treatment. Brilliant. More people are coming and looking for help, more people are getting help, more people are being supported by services. But my question is, if we've had 44% increase of new cases, what's going on? Is it really the fault of individuals? Did people just make bad choices? Did people just not have self-control? Did people just become addicted to alcohol because there was something innately wrong with them? Or was there some sort of big picture thing happening? So just, I suppose, to think about alcohol very quickly, the Irish pub, it's our single biggest export. Okay, the Irish pub is a really important piece of the picture in terms of tourism, in terms of exports. It's very hard to go to any city in the world and not be able to find an Irish pub. You can follow the jerseys. But archaeological evidence dates production of beer and wine, right, about 6,000 BC. Okay, I'm not an archaeologist, I'm married to an archaeologist, but it's about 6,000 years BC. But concentrations of alcohol that are over 5% is a relatively recent phenomenon. And what we know is that public houses of one kind or another have been important sites in social, political, and economic exchange in almost every type of society. So we know that. But again, my question is, what has changed? Are we more likely to become addicted? Is there something wrong with us? Is it something to do with our weakness, our bad choices? Because that's what the alcohol industry would have us believe. But what I think is really important is that in most cultures, drinking happened in places that were separate from communities and separate from families. Drinking didn't happen in the home. Historically, culturally, it's not something that tended to happen. So the Irish pub was separate. You know, there's been lots of texts written about that. They were shady, dark, you know, slightly dingy, but we loved them all the same sort of places. But what we have seen in the Republic of Ireland is between 1996 and 2013, pub licenses decreased by 19.1%, sorry, I forgot the one. That, if you listen to a lot of people, is the great tragedy in terms of what's happening in Irish, the alcohol sort of production and sale in this country. But what we saw at the same time was we had a 377% increase in the number of off licenses. So what does that tell you? And what's that been driven by? It's been driven by price. It's been driven by availability. It's been driven by marketing. It's been driven by, if you think about, you know, women being targeted by marketing, you know, your Thursday book club. If you look at things, I don't know, I'm showing my age now, but The Good Wife, they were always drinking wine. So it was a really conscious thing to heavily market these products to people. And what we've seen is that in 2023, alcohol is now 70% more affordable than it was 20 years ago, despite the fact that in the Republic of Ireland, we introduced a minimum unit price for alcohol in 2019. The alcohol industry is really fast-moving, really clever, really deep pockets. They could easily, Gary, afford a 2-day conference in the Millennium Forum. But what we've got to think about is, you know, at some point we need to say, you've got to stop pulling people out of the river. We need to go upstream and find out why they're falling in. So I suppose Owen talked about the river, and the river in Derry is a place of beauty, but it's also a place, for many people, a place of harm. But what Bishop Tutu, one of my own personal heroes, talked about was the fact that we've got to move towards prevention. We've got to understand why people are drinking in bigger numbers, why more people are dying in our lives, in our families, in our communities. It's not because we're broken people. It's not because we make bad choices. It's not because we're weak. It's because, according to the World Health Organization and 20 years of research, we know that it's because of price, availability, marketing. Alcohol is an addictive substance. It's sold under license, and it's sold under license for a reason. But just to give you an idea, who's driving this, okay? The alcohol industry is worth $17 trillion in profit every year. Now, I talked to the guy who came up with that statistic, and he said to me, Paula, you're probably talking plus another 20 to 30% on that. It's really hard to understand the significant size of the global alcohol industry. 3 producers produce 50% of all of the alcohol on this planet. So when it comes to working together, they understand that if they can drive consumption of alcohol up, their profits go up. And let's look at that. See the top little 4% on the first one? I'm not going to go through this in any great detail. But 4% of people who consume alcohol consume 30% of the alcohol, and they're responsible for 23% of the profit. So when the alcohol industry sponsors campaigns that say drink sensibly, it's not in their interest. It's a conflict of interest between health and profit because the Pareto principle applies in the alcohol industry. 20% of the drinkers drink 80% of the alcohol. So they need, with a profit-driven goal, they need to get people to consume more, they need to get people to start drinking earlier, and they need people in addiction. Because people in addiction at their conferences, they call them the super consumers. They don't call them people in addiction, they call them the super consumers. So it's I suppose, a friend who works in, why has that not come up? Oh, there it is. Nathan Manny in the University of London has looked at this, and he said, if everybody drank in moderation, that would mean there would be a 13 billion loss in profits year on year. So it's very clear from 20 years of research and evidence what works. So the Global Alcohol Strategy was launched back in 2010. The Global Alcohol Strategy was based on really sound evidence. People worked really hard. It remains in 2023 the only global agreement and policy document in relation to alcohol. And what unfortunately has happened is they've called from 2010, when they launched it, to 2020, has been described by the WHO itself as the lost decade. What does the lost decade mean? It means that they knew what needed to happen, but they weren't able to get the buy-in. They weren't able to get governments to buy in. They weren't able to initiate change. So we knew what needed to happen, but we didn't do it. That's a problem. So in 2022, we had the new European Framework on Alcohol. And what I want to talk to you about is, I think the tide is starting to turn. I think there is a recognition that if you want to turn the ship and you want to change the picture of harm, you're going to have to involve communities, you're going to have to involve community organisers who know how to do this stuff, and you're going to have to involve people in recovery. Because people in recovery know better than anyone else where the problems are, why the story needs to change, and how the story needs to change. Because what drives change is emotion. Listening to Owen this morning, listening to Gary this morning, I felt emotional. I understood it intellectually, but I felt emotional, and emotional drives me to change. That is what drives humans. So it's stories that bring change, not statistics. It's not, your science. Yes, we need it to back us up so that we're sure of the feet that we stand on. But after the 10 years of the last decade, the WHO is now saying, yeah, okay, we need communities, we need recovery, we need lived experience, we need to change the story, and we can't do it without you. And that's why I have people in Barcelona this morning and people in Brussels this morning, because they're starting to hear the stuff that we've known for 10 years. So let's not worry about that. So more than, I suppose we're a small organisation, but we're not an organisation on our own. We're part of a movement, and we're a movement-building organisation, which is why, Tommy is here, who's from Northlands. We're going to work with them and talk to them, which is why Gary's here. We're going to work with them, talk to them. We don't believe in having an organisation that needs to lead this stuff. We believe in working with others, collaborating with others, and building a movement for change. But look, we've had some success, and I always feel a bit shy about this, but I'm really proud. We have, in 2021, I think, I lost a sense of time during COVID. It's just 1 year, okay? But in 2019, we launched the I-Mark, and the I-Mark really is the independence mark. So it's a mark of independence where organisations sign up to say, we won't collaborate with the drinks industry, we won't take their dirty money, we won't partner with them, we won't share a stage with them, and that we are an organisation that believes there is an inherent conflict of interest between the profit-driven movement of the alcohol industry and health and well-being. And that I-Mark movement has really taken off. Actually, Arc Recovery were the first organisation in Northern Ireland to adopt the I-Mark. There's over 40 organisations in Ireland that have now adopted the I-Mark. It has been written about in the British Medical Journal, in the Lancet, in the Journal of Alcohol and Other Drugs. We've presented on it right across the world. We're pretty proud of it, but we need to build that movement. So one of our big successes was we launched a campaign last year to have drink-aware materials and programmes removed from Irish schools. It took us a while. Took more than us on our own to move a mountain, but the Department of Education, the Health Service Executive, and the Department of Health in the Republic of Ireland issued a diktat last December, 1 day after we were on the RTE News, to say actually they're out. There's a conflict of interest. Those materials in schools for school children include nudges. They have really, swanky materials with really beautiful images. They normalise alcohol consumption as an ordinary, everyday thing that you need to do if you're going to be an adult in Ireland. So we have that. Building safer communities. It doesn't sound like huge money to some people, but we're absolutely delighted. We've just got a research grant to research our community work in 12 sites around Ireland. And we've got 300,000 from the Department of Health over the next 3 years for research. Because, as a global expert said to me last year, he said, Paula, you're doing everything right, you just can't prove it. Okay. So I thought, oh God, we can't prove it. So what do we need to prove it? We need, independent academic partners. So at the moment, we don't, everything is an uphill battle. At the moment, our government is debating the sale of alcohol bill. The sale of alcohol bill will change closing hours to 12:30. Normal. Late pubs will be able to apply for a license to be open till 2:30 every night of the week, and nightclubs are going to be able to stay open until 6 a.m. but serve drink until 5 a.m. These are significant liberalisations of alcohol licensing in Ireland. And I'm thinking about Owen talking earlier on about ambulance services. Ambulance services in Ireland have said, we haven't got the staff, we haven't got capacity to deal with, the increase in assaults that will happen, the increase in antisocial behaviour, the increase in injuries. The Garda Síochána have said the same thing. And at the moment, that's our big campaign, is to push that back. I've gone through these, so don't worry about me. How am I doing on time? Yeah, I'm bang on. So I'm just going to talk to you about some of our lessons learned and to sell a little bit of hope. And it's not saying that we've the perfect story. Everybody needs their own. But the things for us that have mattered is real change is only possible if it's carried out with people, not for people. So public health and an awful lot of that stuff treats communities as if something you do policy onto. We need to really move towards co-creation. And that's not just co-creation of the policy, it's co-creation of the knowledge. How do we understand alcohol and other drug harm? Who gets to speak about it? Who gets to define what the agenda is? And who gets to be involved in making the changes in our society? Change makers are committed to that co-production of knowledge. Communities, recovery communities, and geographic communities, they're active agents of change. We're not passive. We're not going to lie down. We're not going to just say, yes, if you say these changes are possible. And it's the biggest way of challenging the narrative around the nanny state. Because everybody says when you talk about MUP or you talk about restrictions in marketing, restrictions in hours, they're going, oh God, there's the bloody nanny state. If people look for these changes, you get rid of that narrative and you get rid of that argument straight away. Participatory and collective ways of working and learning are core to community action on alcohol. I think that's been really obvious in the morning, is that we're not talking about sort of faraway expertise. We're talking about sharing the learning together. And I hope that today I'm going to learn as much, if I get a chance to talk to people, I'm going to learn as much from all the people in this room as me being a speaker, which is slightly always uncomfortable, but it's okay, we're nearly done. Last slide. So what I'm going to say to you is join the movement for change. Join our movement, make up your own movement, but believe that change is possible. Alcohol harm and other drug harm, they're not inevitable, and they're not the result of weak people or poor choices. They're being foisted upon us by very big political and economic interests, and unless we stand up, our government is not going to be supported to make the brave decisions and changes that it needs to make. That is me. I am all done. I'm going to hand you back to Gary, and I'm going to say thanks a million.